what is your approach with clients when a new client comes from you? What is the first thing you do and how you develop your work with them?
Right. So I think that, and this goes for strength and conditioning coaches, for physios, I think that the assessment and the way that we evaluate our people is extremely important. And so one main focus of mine is trying to get as many objective measures as possible. And there are a few different tools that I use to do that. So if I have somebody that has a hamstring injury, I'm going to use a handheld dynamometer to test their hamstring strength.
Okay.
And I would want to test their hamstring at different joint angles. For example, the hamstring is a 2-joint muscle. It crosses the hip and the knee joint. So the function of the hamstring is remarkably different when your hip is extended versus when your hip is flexed and you're sprinting, right? It's much more lengthened when your hip is flexed. So I would need to test the hamstring strength at both of those positions, not just one.
Yeah.
So that's just an example of my thought process in terms of how I can help to assess my patients and what starts off our rehab process. Now, with an ACL or somebody that had a more catastrophic type of injury, you might not test their strength at first if they just had surgery or they're in a lot of pain, because you're not going to get an accurate measure, and it might not be appropriate at that point in time. So for them, it's more of a aggressive but still extremely cognizant approach to pushing them forward. And for a lot of my people, it's more of an athletic approach. So how fast can I get my ACL patients using the Airdyne bike? How fast can I get them using battle ropes? How fast can I get them to do anything that involves faster movement to continue to facilitate their nervous system, to facilitate those high threshold motor units, and to just continue to help them be athletic throughout that rehab process? Now, a big part of my practice, and something that I feel very strongly about, and I don't talk about it as much on Instagram, but you might have seen it if you follow pretty closely, is the psychology of all of this.